Hi, everybody. Glad you guys could join us tonight. My name is Dr. Tyndall. They said I'm a chiropractor and naturopath. I've been doing chiropractic work for about 30 years. I've been doing naturopathic nutrition work for about 20. I've been doing some teaching for standard process, and I do some workshops for the local doctors or the doctors around the state. So that was going to kick off pretty good last year, but except for the COVID crap. So that got kind of shut down for a while, but we did a lot of Zoom work. But basically what we do is we have in my office, I've been doing naturopathic work and chiropractic for about 20 years, or for the naturopathic, I mean. And then just here recently, last year, we decided to do some more online distance work because we get a lot of people that were being referred from family members. And so we try to make it a little bit simpler for people to get our access to us and our paperwork and forms. But basically what we do is we take a real thorough approach to assessing a patient. So like when a patient gets us for a consult, we'll send them out. It's actually about 14 pages worth of paperwork, because what we're looking at is your health history. We're looking at your stress index, your brain indexes, your toxicity questionnaires. We do symptom surveys because a lot of your symptoms tell you what's going on with your body. A lot of lab tests and blood tests don't pick up. And then what we do after that is once we get a patient's information back, I'll spend whatever time I need to do, because I'll go through their medical records, all the information they filled out, and then I'll make notes, and then I'll prepare. And then what we usually do is about a consult, which usually lasts anywhere from 30 minutes to an hour, kind of fleshing out what's going on with patients, asking more questions, getting feedback from patients. We start talking about their diet, lifestyle, dietary changes, because we tell people you can't supplement away a bad diet. You can't exercise away a bad diet. You have to have all three. You have to eat right. You have to move right. And you have to be thinking right. And so that's kind of what we do. We get a lot of people, we kind of see a little bit of everything. I've worked with people with brain trauma, cancer. We don't treat cancer, we treat people. Diabetics, PCOS, just you name it. We've over the years have seen it. Been doing it for a long time. So I get a lot of requests. Like just the other day, I got a request for doing a sick dog. We've worked on raccoons and deer and coyotes, you name it. We've kind of had our fingers in it and doing some work with it. So it's great work and it's interesting. And I'm just telling Greg and them last night, I was out in the snow until 11 o'clock doing house calls for the Amish, because they do a lot of chiropractic and nutrition work. They're all about trying to be healthy and do things the natural way. And then tonight, as a chiropractor, this is a great thing that Greg's doing for us, because we deal, of course, a lot of pain. So in office, we use a lot of herbs for pain. We use like nervogesic, turmeric, boswellia, things like that. We also use some supplements like omega-3 fatty acids and things like that to help hemp oils to regulate the endocannabinoid system and help with pain. So it's nice to add. And then we do some combination of some oils. We do a blend that we call a liquid morphine, but we use a lot of marjoram in our office prior to the adjustment. Thanks, Christy. And so what we also do a blend for migraine headaches. We do a blend for we call it a liquid morphine, which it's frankincense, marjoram, helichrysum, lemongrass. I'm trying to think of the other ones. But it's a great blend. We get a lot of really good results with it. We love using Greg's oils for it. So people really notice a big difference since we've kind of switched to his brand. So it's been real good for us. So anyhow, enough from me. Our website is newlifenaturopathic.com. So if you guys ever need help or questions or whatever, feel free to contact us.
Dr. Tyndall, one more question. is do you mind talking a little bit? I think thyroid issues are so kind of rampant these days. Do you mind just talking about your approach to thyroid issues and things like that? I know several people have asked me about it, and I've given you as a reference, and I know we give you as a reference from Astara. And so I just, maybe if you take a couple minutes and talk about the thyroid approach.
Yes. First thing you have to realize that all thyroid issues aren't a thyroid issue. I wish if I'd have known the question was coming, I'd have pulled Harrower's chart out. We do a lot of blood testing, and we look at people's labs and stuff, but I've actually on our website, I put together what I call it myself personally, it's Harrower's lab work. But basically what you're looking at when we do the thyroid, we run a panel that does TSH, T3, reverse T3, T uptake, antibodies, and then we do liver panel. We do adrenal, like some cortisol, CBC, CMP. So basically what you do is when you're looking at your blood test, you have to have all that information. You have to have the TSH, the T3, the T4, the reverse T3, all those labs done. Because if you to assess the thyroid properly, and here's kind of how it works. Let's say if I get a lab that my T3 is low, okay, so I'll go back. If medical doctors will usually run TSH, maybe T4, and that's it. All that's doing is telling you my pituitary, what my thyroid is doing. The problem that you have is it tells you nothing, okay? Because your thyroid depends on what your liver's doing, your adrenals doing, your hypothalamus is doing, you get feedback mechanisms from your ovaries, your pancreas, your gut, your whole body's intertwined. So here's an example I use in my office. Let's say I have a patient who has a low T3 level. So what you do with the lab is you go at the very end. My goal is to make T3. So you would go back and go, I got low T3, my T4 is normal, my TSH is high. So if I was a medical doctor, I would say, oh, you have a thyroid problem. Well, you kind of don't. And here's why. So you go, what happened is my T3 low. So I go to the top of the system and I go to, did my hypothalamus work? Well, yes, it did, because it told my pituitary to make more TSH. So the pituitary is working because my TSH level went up because I have a low T3. So I don't have a hypothalamus or pituitary problem. So I'm now down to the thyroid. So did the thyroid do its job? Well, yeah, it did, because T4 levels are normal. Well, T4 is converted by the liver into T3. So if you had all those, that the system did what it's supposed to, you're more than likely looking at a liver problem. So to address a thyroid problem doesn't do any good. So for example, like one of my patients, she was from Alabama. She was laid in bed because the doctors took her thyroid out, and they put her on Synthroid and put her on massive doses of it. And she laid in bed for basically 2.5, almost 3 years, just miserable. And finally called me, just kind of a referral thing like we did in the past. Anyhow, we got talking to her and I went through stuff. Well, we did some labs, and then, through the history, we figured out, man, you got a real bad liver problem. So what we did is we changed her diet, got rid of the bread, cake, skin, pasta, sugar, because that down regulates your thyroid. And then what we did then is we started working on her liver to detox her liver, and then start supporting phase 2 detoxification of her liver, and then started getting organic selenium from a plant source. And what happened was now her liver was able to, through phase 2 detoxification, convert T4 into T3. And so with her, since they cut out her thyroid, she's on Synthroid from now on. But now what's happened, since her liver can convert to Synthroid, her amount of medication that she's taken has dropped significantly, and now her body can actually do the conversion. Now she feels better. She's got her energy back, and she's back to working, and all that stuff. So we have to look at. So, for example, this can get long, but for example, the reason you do your reverse T3, because if your cortisol levels are elevated, your body will make a left-hand version and a right-hand version. Well, the left hand turns our metabolism on, gets our body going, boom, boom, boom. Now, for under periods of stress, like we're moving, stress should be short term. But in a modern society, stress is now long-term, which is a bad thing because cortisol levels go up. What it does, it causes the body, instead of making the left-hand tree through that turns on the metabolism, it makes a right hand. So it's like taking this right hand and putting a left-hand glove. It fits kind of, but it stops the mitochondria from producing ATP and it preserves energy. So what happens is the patient starts to gain weight and they can't burn energy. They're tired all the time. And so once again, you see your TSH levels will go up because the body's like, the feedback mechanism is say, hey, I want T3 to turn my metabolism on. I got to get going. I got to get going. So the pituitary and the thyroid like pumps out the TSH to get this, to try to really crank up your T4 and your T3 to get your body to respond, because such a small percentage of it's getting converted over. So, yeah, so it gets very complicated. So if you don't, and most medical doctors aren't trained and taught that stuff. So we spend a lot of time learning that and, work with patients. And then, for example, if we have a patient that has like a looking pretty good, but their T3 uptake is down, that means that they're missing minerals. So iodine, selenium, or their parotid gland's messed up, because their parotid gland will direct minerals into the different tissues. Could be a vitamin D deficiency or vitamin F deficiency, because those carry the minerals into the thyroid. So that's why you have to look at the T3 uptake. So it's actually longer, and I could go on for probably another hour or so, but that's pretty much the gist of it.
Am I unmuted? So I think it's a great intro to that. And I think that really helps to show that you're not just simply looking at a symptom and then giving a supplement or something, that you're going through and evaluating something, looking at how the body is functioning and then trying to correct the problem rather than just trying to chase symptoms, which is a lot of times like chasing your tail. And
yeah, because a lot of patients, a lot of people, that's what their whole life has been. People have been chasing their symptoms, and you want to use the symptoms as a key or like as a roadmap. Like what the symptom is. You have a symptom because their physiology is messed up somewhere in the body, and so and the problem that you have if you don't know what you're doing is that it's like when you do our symptom surveys, you'll see the question, like the same question acts like 4 times in different areas, because like for example, people who have weight loss or are hungry, I can't eat, I'm hungry all the time, I ate and I'm hungry, I can't lose weight. Well, you have to figure out if it's it's usually a hypothalamus, pituitary, or thyroid problem, or a liver problem too. So you got to figure out which one it is. So you have to. So when you start going through all the symptoms and going through the history, and you're delving out stuff, and you start asking questions like, I know it sounds like weird questions, but like we talk to people like, like your poop and how you poop and like how often you urinate, what color it is, and if it smells and stuff, and if you wet your bed at night, or lots of these different things, because if you're retaining water. So you're now trying to figure out, well, if I'm retaining water and I'm having all these other problems, it indicates maybe a pituitary problem. If I'm hot and cold, heart palpitations, hungry all the time, can't lose weight, then that kind of indicates I have a hypothalamus problem. So I have to fix the hypothalamus, which there is no blood test for. So you have to, really delve into, and that's why it can take up to an hour, even after we've read all your stuff, after we've looked at all your medical records. It can still take another hour to go through and try to really figure out. And you have to figure out, you don't fix everything with a person. What you have to do is you find out the main problem, try to fix that with, once again, lifestyle, dietary changes, getting them exercising, getting them moving, getting them healthier. And we use that, we use the supplements, we use herbs, and we use the oils to try to repair that physiology. And then you see what kind of clears up, because a lot of other organ systems are compensating. So once you kind of clear that system up, and it takes anywhere from 3 to 6 months, because some of these people have been suffering for years, decades, and it's not going to go away overnight. So what you kind of do is you constantly working on the dietary habits, because that is actually the hardest part of it. It's easy to pop the pills and slather on do the oils and things, and the biggest part is people just taking responsibility and getting their lifestyle under control. And that's what we really focus on, is getting that straightened out for them. And then, and then once we kind of got to a certain point with a person, we kind of do a reassessment and see what we need to work on next.
Tremendous. Good. Yeah, we should do a little interview with you on Stara. Like we can go back and forth, and instead of just having you submit videos on things, maybe we could just go through and have a conversation and tape it. And
that's fine. I actually like that better, because my problem is I never know what people want to hear. The things I like the geeky stuff. I like the science and why it's why. And most people are like, I don't care why, just tell me. So it's nice to have the feedback to figure out what people want to hear and their questions and stuff and answer them, because what's important to me is not important to other people.
Right. Well, I think thyroid issues are a very big deal these days. So I think that your multifaceted approach to that and really going down the rabbit hole is tremendous.
Thank you. It's for me, I like it because it's I love puzzles. I know it sounds funny, but I like figuring things out. And it's for me, it's mentally stimulating, and it's a great, for example, like right now we got a kid that we're working on with vax damage. Doctors told the parents to just let him die, bring in hospice, let him die. It's heartbreaking, and because basically what happened on his 9-month vaccines, they said all the records indicate he doesn't had any shots. So the lady goes, oh no, he's had all of them. And so they gave him 3, 6, and 9, and then they said, since you're not taking care of the kid right, we're going to give you the 12 also. So they gave him all at once, and the kid ended up having seizures and couldn't walk and couldn't talk, and was starting to kind of crawl, just real bad. And then so it's been a couple of years, and I just finally got to see him here. Well, that happened a couple of years ago, and he got referred to me. He got referred to me, and he can't, when he came in here, the mom has to carry him. He can't talk or anything. Long story short, we put him on supplements. We're doing some chiropractic work. We're doing some cranial adjusting. We're doing some PEMF work with him. And the other day he walked with assistant to his mom. He walked into the office.
Wow, that's tremendous.
And he's she said he's added about 50 words to his vocabulary, and the people at church see a huge difference in he actually socializes with people and waves and says hi and stuff. So it's a great it's a great to see that change in that kid's life, and hopefully we can continue to do some stuff. So we're doing some like oils with him, like heliochrysum, try to repair some of the damage that's inside of him. And I'm trying to think of the other one. We're doing Ivy's been helping with that because she's been studying the oils. So she got him on another one that's helping with some detox, and then we got some trying to get the heavy metals out of him and stuff. So that's what we do. Yeah.
That's a tough one. That you've even gotten that far is amazing.
Yeah, it's I got another one of my other ones was favorite one. I'll go real quick with it. Another vaccine damage. She was I got to see her when she was 9. She could walk and stuff, but she couldn't talk. She's never spoke. Well, she did prior to the vaccine damage. So she, anyhow, her mom, we went through a bunch of stuff with her. And after about 6 months, her mom came in one day and was crying her eyes out. And I'm like, oh, crap, what's going on? It's like she was like bawling her eyes. And I walking, you've had that great when you walk in the room and they're like crying. You're like, oh man, what's going on here? Anyhow, she finally got her breath, and I said, what, I was kind of timid. I'm like, what happened? She's kind of afraid to ask. And she said, I just want to thank you. And I said, for what? She said, well, my daughter said to me, I love you for the first time in my life. So yeah,
wow,
get to do that stuff.
Wow, yeah,
makes it worthwhile.
Man, no joke. That's a big one.
Now, Dr. Tyndall, someone just typed in the chat, are you using chelation for heavy metals? I don't know if you can say that or not, but.
Well, kind of what we do. What we do is slow and steady wins the race. There's different things that we use with to help kind of chelate out. Like if depends on who. And some of the stuff we we don't keep in the office. We just tell patients, here you go, get it. So if we have especially kids that are fairly young, we have them use metal free, which is a great product. You have to be careful as you get older, because if you actually have a filling in your arm or you have a metal plate in your body, it will actually dissolve it. So you have to be kind of careful how you use it. We also use some herbal blends called Chelico, and we use parotid a lot. Then we use the purification program that we have. We use standard process, which is a whole food supplements, because that's a whole different gamut. There's a huge difference between whole food supplements and synthetic nutrition. Just kind of like back to oils, you want these oils that from the plants and from where they're at and from the dirt that they're from to make them the best that they can be. And that's kind of how you want it with your supplements. They're made from food through standard process. So we use those, and we do just kind of we stay at it. Because there's lots of issues that you have to repair as you get the heavy metals out, because they do a lot of damage.
Great, thank
so we
you.
do, yeah. So.
Well, Teresa, is there any more questions for him? Or?
No, but if you guys do have questions, I am gonna just kind of keep Dr. Tyndall and Greg unmuted. But if you guys have questions, please type into the chat. We can ask either Dr. Tyndall or Greg, whoever is the most best for that situation. So.
And you can always reach out to Dr. Tyndall, directly to his office. So, that's why we're posting his information and everything. And that's why we were posting it on Astara as well. Is you can tell he's a valuable resource that is not just chasing symptoms and is going after something and really helping to try to correct something in the body. And I will say, like, the thing with the person reacting to the vaccine when their body goes rigid like that, it takes a lot of hard work and somebody who really knows what they're doing to be able to get the person to be able to even walk to the level and degree that he's doing. And that's really an amazing feat. I've seen several of those cases, and those are very, very tough cases. When kids have the reactions to the vaccines like that. So anyway, so we are going to talk about pain tonight, and pain is an interesting topic. I always thought when I wrote all the different classes that this one was going to be just the one that was going to keep me busy all the time, and it is not. Usually people start turning to how to manage pain when you're in the middle of the crisis. And so it's good to kind of educate yourself about pain. There's this old Chinese saying, like, don't build a toilet when you need to go to the bathroom. You have a bathroom already in your house. You don't build it when you need it. And so pain is something that impacts everybody. It is the number one reason in modern countries that people seek medical attention for. In third world countries, it's more things like infectious diseases and things like that. But in the more modernized countries, the number one thing that people seek medical attention for is pain. And so the thing that's very interesting with pain is it also is very transient in nature. It's not always a constant. It can fluctuate quite substantially. Now, pain is usually an indicator of a problem. And sometimes when we get the pain to go away, we think the problem is resolved. But a good example of this would be if a bone or a piece of cartilage is pinching a piece of nerve, you're in some pain for a little while, and then eventually that pain goes away. That's not necessarily a good sign. That actually can be a sign that the condition is progressing. It's just like when you sit on your foot and your foot goes to sleep, your nerve has gone to sleep. And sometimes what happens with the pain diminishes, but the issue at hand is that the nerve isn't flowing to that particular area. And so the issue isn't really resolved, even though the pain has resolved. Basically the nerve has just gone to sleep. So the thing that I like to do is look at the different kinds of pain. And kind of in the same spirit as Dr. Tyndall here is, I don't like to just look at it from a point of view of going after a symptom. I like to look at the other aspects that go along with the different kinds of pain. And, over the years, we keep boiling this class down. The very first time I presented this class, the booklet handout was about 200 pages. Too much information. It was way too clinical. And so we've really boiled this down to just the ability to look at something and treat it without having to go down any sort of rabbit hole. And so we look at really basically 5 kinds of pain. There are other types of pain, but they're less common. So we boiled it down to the 5 types of pain. And then within each type of pain, kind of the 4 top things to look at when that kind of pain is present, right? And so pain doesn't present just by itself. There's usually a series of issues. And so right off the bat, probably the most common type of pain is what you would call nociceptive pain. It's basically just dull, achy pain. It could be a result of a strain. It could be a result of muscle imbalance. It could be a hip is elevated or a shoulder is elevated. Basically what can happen over a period of time, and this even goes back to what Dr. Tyndall was talking about, is sometimes your gut is causing the issue in the skeletal muscle. So you have this system in your body called the lymphatic system that goes through and basically is the garbage pickup of your body. It helps pick up excess fluid when your cardiovascular system is pumping blood through the system, but also helps to detoxify the joints and the tissues and things like that. And so we also have a lot of lymph vessels and nodes in the stomach and the gut. And so what happens sometimes is the stomach and gut can become so impacted lymphatically that it actually slows down the lymphatic movement in other parts of the body. And so with this, areas in your body will start to become dull and achy. And lymph nodes will start to shut down in particular areas, and again, just your body's ability to detoxify, to filter, to go after organisms like viruses, bacterias, and even chaotic cell growths, which would be different types of tumors, and be it benign or malignant, is really looked at when you are looking at the lymphatic system, especially the lymph nodes, right? So nociceptive pain is dull, achy pain. It's not sharp, it's not stabbing, it's just simply dull, achy pain. It could be just an achy joint, it could be all your joints, it could be, some part of your back, it could be a knee that it's not really sore, it just aches, like it just kind of wears on you. Now, the thing is, when the lymphatic system starts to shut down, part of the issue is that you'll also start to slow down. Your joints will get achy, for one, the skin gets itchy, but notice your cognitive abilities start to slow down quite substantially. Like it's just a little bit harder for you to process things. It's a little bit harder for you to make decisions. It's a little bit harder for you to bring things up from your memory. You'll just always be going, and it's just not like you're thinking of wrong information. It's just, you're just slow to process these things. And so this fuzzy thinking is also a byproduct of the mechanisms that produce nociceptive pain. So the first thing that we do is we go through and we look at what is happening in the body. So with nociceptive pain, a particular part of your body that's aching is basically toxic, right? So we use essential oils to go through and reduce the achiness, but we also reduce the tension or the spasms that are in the particular area, and we get the lymph moving in that particular spot, right? So there, we still use things that relieve pain, but we also use things to relieve pain that also deal with accumulations or deal with basically tissue toxicity, right? In aromatherapy, a lot of times we call stagnant lymph basically accumulations, but you could call it by a lot of different names. But one of the things that we try to do is to reestablish this movement. Now, here's the issue that takes it a step further. A lot of times people don't really think about the aspect of tight muscle, tight joint, you know, a little bit of a strain or a spasm in a certain part of the body. For one, when that happens, the ability for blood to move in and out of that area is restricted, right? And then the ability for other fluids, such as lymph, to move out of that area is also restricted. So now, if I take my finger like this, and I pinch my middle of my finger like this, you can see there's this joint here, and I'm pinching below it, right? So I'm pinching below it. Now, what happens is, within 2 hours, that joint right there, with me pinching like this, if I hold it for 2 hours, it would become pre-arthritic, right? It becomes pre-arthritic because the lack of blood and the lack of the ability for blood to leave the area is starting to degenerate that joint. So you could be walking down the street, somebody bumps into you, you kind of strain your back a little bit, you get a little bit of a spasm, and you go, you know, I'll shake it off. But that already starts a downward spiral of your body starting to degenerate, right? The reason why this joint starts to become pre-arthritic is in between each joint, as two joints are moving like this, you have a piece of cartilage, right? A piece of cartilage, right? So in your back, it would be the discs. In your knee, it would be the meniscus, right? So different areas have these pieces of cartilage. And so what happens over a period of time is if there's a big spasm in and around that area, that tissue, that cartilage doesn't have its own blood supply. It's dependent on the tissue around it to hydrate it and keep it moist and to get the blood and nutrients to it, right? So if there's a spasm around a particular joint, say in your back, in your hip, in your knee, eventually what happens is that cartilage doesn't get the hydration or the nutrients or the blood that is necessary for it to stay healthy. It just keeps breaking down and breaking down and breaking down and breaking down. And then eventually it becomes a form of arthritis. So this nociceptive pain, it is the most common type of pain. And if it's handled when it's in this stage, you really can have a healthier life as your body ages. You know, the aging process is basically an inflammatory process. It is your body's ability to detoxify and reduce inflammation through the whole body, including the internal organs. If your body is not able to handle the inflammation, the body breaks down at a much quicker rate, right? So you basically age at a faster rate. And so this nociceptive pain, it really is not something to be shrugged off as something, you know, like, you know, I'll work my way through it. You really want to address it because it is a reflection of deeper potential issues that might come along, you know, 3 months, 6 months, year, 5 years, 10 years down the line. One of the things that we noticed, for example, is many years ago, I was doing a study with a physician she was a ER physician, and she had gotten a grant with UC San Francisco. And it was back in the early stages of when they were really pushing the seatbelt. There were grants being given to really kind of help educate the public on the use of seatbelts. And so that shows you how long ago it was. It was quite a while ago. And so we were treating whiplash patients for about 3 years. And so we were evaluating like what direction they got hit, how fast, the nature of the injuries. And we really saw a series of patterns depending on what direction they got hit, from the left side, from the right side, they got hit from behind, or they hit the person in front of them. And then there was always the abnormal, got hit at an angle, or they rolled, or, something like that. And so what we started doing is we started collecting the data and just looking at the tendencies for the different directions. And one of the things that we noticed, because we were treating people, right out of an injury, a year out, 5 years out, 10 years out, we even had some patients that had had a serious accident, 15, 20 years out. And so we were looking at the different stages of injury to the body, not just immediate, but over a period of time. And what we noticed was, this was the most severe, was when somebody hit the person in front of them, there was a real high probability that within about 10 to 15 years that they would have a hip replacement on the right leg. And if you think about it, you see the impact coming, your body tenses up, you're slamming on the brakes, and then you slam into the car in front of them. Right? And so what would happen is that right hip would go into a pretty severe spasm. And then just like the pinched finger, within about 2 hours, that starts to become pre-arthritic. And it takes a while. It takes a while for it to settle in. But had those spasms been addressed early on, the body alignment and the spasms in the joint been addressed, then the ability to reduce the need for that surgery would be greatly reduced, but you would have to treat it kind of close to when the accident happened, within a few years. Didn't even have to be, within a few months, like within a few years. And so, what we were doing was we were laying out how to treat somebody regardless of the symptoms that they were presenting with. Like if we knew that somebody came in with an injury and they hit the car in front of them, they saw it coming and they hit the car, usually the first thing they complain about is like neck, shoulder, maybe a little bit of jaw issues. Every once in a while there would be some low back pain, but mostly it was up in the neck. They wouldn't really complain about the spasms in the hip, but we would go through and we would start treating the hip immediately before they even brought it to our attention. And what would happen a lot of times is they would say, after a few months of treatment, that they were feeling so much better and that they didn't realize how bad that hip was bothering them until the pain was gone, until the spasm really was actually gone. So one of the things that we look at with nociceptive pain is we look at the kind of tension that's in the body, because not all tension is the same. There's like, how Dr. Tyndall says, therapists, we tend to be a little bit like geeks. We're our nerds. We like all the little nuances of what we're doing. And when you look at an injury like that, you have things that are called contractures, you have things called trigger points, you have things called spasms, you have splinting of the joints. There's one more, spasming, trigger points. No, I think that covers it. So, I mean, there are more, but that keeps it within the realm of what we're talking about in the class. And so when you're going through and you're treating this, you really want to look at all aspects, not just like, oh, I'm in pain, And so one of the other things that happens too is because of the injury or because of stress over a long period of time, there is a lot of tension in the smooth muscle. There's a lot of tension in the smooth muscle. So the smooth muscle is what makes up your digestive tract, and it's also what makes up your respiratory tract. So breathing becomes impacted, and also the tension in your gut starts to affect how you assimilate food, how the lymph moves in your body. But one of the things that you don't really think about or associate with tight muscle tension in the digestive tract is it produces anxiety. And so one of the things that would be a byproduct of this condition is you're starting to have poorer and poorer sleep. And then eventually what starts to happen is the person starts to have low-grade anxiety. So we want to unwind all these different components, because the anxiety here is not an emotional issue. It's not a mental issue. It is actually a physiological issue. And it becomes an emotional issue or a mental issue because of what the body is going through. But when you go through and treat it, you treat it physiologically, and all of a sudden the anxiety disappears. And so we have a whole like kind of protocol to go through and treat this, because we take into account that a person's going to have a little bit of anxiety when they're in pain. There's going to be discomfort, and they usually start to have a sleep issue at some point. So we try to address everything that we can in this class. We later have a class that's also for sleep and memory that is actually kind of a part 2 to this class. You know, it stands on its own, but at the same time, it's an extension of what we're teaching in this particular class. So when you're looking at this, you're looking at the tension in the gut, you're looking at function of the lymph nodes, but what you're also starting to look at, because of the tension in the gut and because of poor lymphatic movement in the body, right, you're starting to deal with a type of brain fatigue, right? That is the fuzzy thinking, right? So we want to go through and also increase the blood supply to the brain, which helps the brain to detoxify and gets oxygen to the brain and other nutrients. And so when we look at this, we don't look at it simply as let's treat some pain. We want to treat the brain fatigue, we want to treat the lymph node issue, and we want to treat the tension in the digestive tract. So when you go through and do this, for example, we had somebody just about 2 weeks ago. She's had a bad back for quite a while. And, you know, she's very young. She's like in her mid-30s. And, you know, she would lay on a ball and crack her back and go get adjustments from the chiropractor. And, you know, she'd feel good, but the adjustments wouldn't hold very, very long. And so we didn't even do the full treatment. We didn't do the thing for the pain. We didn't do any of that. I simply just gave her something to take the tension out of the smooth muscle of her gut. And she said her back was like, what was it, like 70 or 80% better, just by taking the tension out of her gut. And so one of the things that we asked her was like, do you have anxiety? And she said, you know, she always has anxiety, and she can never figure out what is causing the anxiety, but she has anxiety. Within 2 or 3 weeks, you know, interacting with her again, she seemed more calm, more mellow. She seemed very, you know, just very chill, and her back pain is reduced. So already the anxiety is going down, the back pain is going down. It's improving digestive function, and she's getting more blood and oxygen to her brain. And we didn't even treat the other 3 components that we would usually treat. And so it really shows how dynamic sometimes pain can be. Now, that is nociceptive pain. So the other type of pain that people usually identify with is what we would call neuropathic pain, or just basically nerve pain. So now this is sharp, stabbing, tingling, radiating, you know, prickling sensation. This is your sharp kind of pain, right? So with sharp pain like that, again, you do have tension in the gut, but it actually goes further. Anytime that the body has sharp stabbing pain for any period of time, what starts to happen is you start to develop bronchial spasms. So within a short amount of time, I mean, sometimes it's only like a week or 2, you're actually developing a respiratory issue. And so if your bronchioles are in spasm, the byproduct of that is you're able to inhale kind of okay, but as you exhale, your exhale is very short. So for one, you're not getting in a lot of oxygen, you're having to strain to exhale, or you're just not exhaling very much, right? Making the body a little bit toxic. But what's starting to happen is that's starting to wreak havoc on the nervous system, especially the fight-flight system. And it's starting to increase body tension all over the body, especially on the spinal nerves. And so one of the things that we look at when we're treating this is, yes, we want to reduce the nerve pain in the spot. I mean, point blank, we want to do that, right? But then anytime you're dealing with nerve pain, you're dealing with either an entrapment or an impingement, usually, right? So one is when like bone and cartilage are pinching a nerve, and another one is like when soft tissue is pushing on a nerve, right? So if this was a neural pathway, right, and I laid the weight of a nickel on this neural pathway, that nerve would actually start to become compromised and would actually start to puff up, right? And so as it goes down the line, and it starts to go further down the line, it becomes easier and easier to have weight on that nerve, and it becomes more and more compromised. Now, when there's a moderate amount of pressure on a nerve, it excites the nerve. When there is substantial pressure on a nerve, the nerve goes to sleep. So sometimes people will have a nerve impingement, and all of a sudden the pain goes away, and then a few months goes by and they'll go, one leg is smaller than the other. It's because the nerve has been compromised and hasn't been say feeding the nerve, the leg, so to speak, or the soft tissue of the leg. And so they'll start to lose muscle mass. And so when we're going through and dealing with this, we don't want to look at just the nerve pain. We also want to look at the respiratory issue and unwind the respiratory issue. So this is a good way. Let's just test to see where you're at, because here's the thing too, the nerve pain could have passed. Like say you had nerve pain 2 years ago, and the injury went away and it got resolved and all is good, right? It doesn't mean that your bronchioles then go, okay, nerve pain is gone, we can go out of spasm now. So why is this important, and why am I lingering on this part, right? So when the bronchioles are in spasm, this usually means that it's harder and harder for you to take an inhalation and an exhalation, which means that it starts to cause a spasm in your diaphragm, right? That goes across the bottom part of your ribs, and the muscles in your neck have to work harder to elevate the rib cage because of that spasm in the diaphragm. So it starts to increase tension in the neck, right? So right there, you're going to be more prone to sleep apnea. So right there, you're already starting to be more prone to having a sleep disorder, because the tension in the diaphragm and the muscles in the neck having to work harder, the airway, the opening in your throat for air to move up and down keeps getting smaller and smaller. So any sort of physical blockage that you have there is now going to be exaggerated, right? When your breath is short and rapid, body tension starts to increase, which means more pressure is being placed on the nerve. You are going in a downward cycle that keeps getting worse and worse and worse. Now, the other byproduct of this is when you have a short, rapid breath, whatever emotion, whatever level of stress that you have becomes magnified simply because of the shortness of breath. They've done studies where people who have a short, rapid breath, they can easily induce anxiety and then eventually even a panic attack, right? And so the muscle of the spine, the little muscles that go in between the spines called the multifidi, they directly correspond to the tension in the diaphragm. If the tension in the diaphragm gets really tight, then the tension in the spinal muscles, they kind of go in between all the little vertebrae, right? They directly tighten up. If you can relax the diaphragm, those muscles actually relax as well. Just by deepening the breath, sometimes you're actually starting to reduce the tension on the spinal nerves, especially the roots. So here's an interesting case. So I had several cases where people were trying to recover from COVID. They were post-COVID, they had gotten over the viral part, but they were still having some serious respiratory issues. It wasn't because they were sick, but their respiratory system wasn't bouncing back very fast. And so they were complaining of pressure in the chest. So they were getting treated and getting evaluated for heart-related issues. And they found that there was no heart-related issue. Right? They would have the pressure in the chest, and then they said that their legs started to tingle, and that they were even starting to have like burning sensation go down their leg. And a couple of them said that their legs were starting to go asleep when they would just be standing or sitting. And so we went through and we treated the respiratory tract. We treated the digestive tract as well, but mostly it was the respiratory tract. We treated the bronchioles, we loosened up the diaphragm, just trying to help them breathe a little bit more, right? And in doing so, the back pain went away, the leg pain went away, the numbness and the tingling went away, the burning sensations went away. All of this went away because the pressure off of the spine and the spinal muscles had been greatly reduced. And so all of these things are interwoven and tied together. And so when we go through and treat this, we're not just simply looking at, we need to block the brain's ability to feel this pain. We need to undo the effects of the pain or what caused the pain, right? So before I keep going, because I can keep going and going and going, there's still two other kinds of pain that I'd like to talk about. But from right at this point, let's just take a few questions before I move on to degenerative pain.
And you can unmute yourself, or you can type in the chat box. For those of you who are new to Zoom, if you are on a desktop, the chat button is on the screen down at the bottom. It looks like a speaker.
Okay, Greg, I'm going to ask a question by proxy for somebody.
Okay.
My neighbor's teenage daughter has scoliosis, and so she's had surgery for it, but she's still, despite that, she still has just ongoing chronic pain. And
so she has idiopathic scoliosis, like she was born with scoliosis, like the rib cages are different shapes and a little bit.
I don't know the details of it, so I can't answer that, but I know that from what I understand, she was a young teenager when she had the surgery. So, but she just has chronic pain, basically. And she doesn't want to do, Western pain medicine just because of how they do it.
Right. Yeah, so I mean, this brings up a good point, is, with nerve pain, there's actually a medical term for it. Maybe Dr. Tyndall remembers. I can't remember. It's a very long term, but it just means like post-surgical, basically, and it just means the pain is still present, right? And so what happens is, you go through and you have severe nerve pain, you have the surgery, but they're usually fusing something, or they're taking a piece out, or they're doing a nerve block, something like that. And so the surgery corrects the structure, but the structure wasn't causing the pain. It was the soft tissue, right? It was what was happening in and around the joint. Anytime a joint gets compromised, the tissue around it starts to tighten up to protect that joint. It keeps you from moving it too much and having too much mobility or overdoing it there. But at the same time, it's reducing blood flow to that area. It's reducing oxygen, and that constriction continues to put pressure on that spinal nerve. And so what happens when a person has that issue is the surgery might have corrected the structural, misalignment or the pressure on that nerve, but the issue is still stuck in the soft tissue. So you still have to go through and unwind the spasms with the person, and also use things to reduce some of the pain, because the pain, sharp stabbing pain especially, just by its nature makes the body tighten up. Like, it just makes you psychologically just it hurts. And so when you're looking at issues with scoliosis, one of the things that you want to look at is, like, so instead of having a spine that's coming up like this, where's our spine? Can you bring me the spine? Hold on just a second. I'll actually show you just hand me the spine off of this thing. Okay, perfect. Okay, so we have a spine here. I don't know if you can see it all, but you have a spine. So what happens is they'll start to like have a scoliosis, is like it's not straight, right? So you can see, like, if there's a curve, right, it's shorter here and longer here. Like if you see if like the spine is doing that, right? So the muscles here, you want to kind of go through and evaluate like where the muscles are shortened and where they're elongated, right? And so a lot of times when you see something that is acute, it's the pain is usually in the shortened muscle area. Like, so when you're looking at scoliosis, they usually aren't having pain in the shortened area, they're having it in the elongated area, which means that it's chronic. So the typical thing is to keep going to the area of pain, and you loosen up that tissue. Well, muscles balance each other. They work with each other and they work against each other. So if something starts to lose tension, then the things that oppose it go into a greater spasm, right? So when you are looking at treating scoliosis, you want to constantly keep unwinding the sections that are kind of in the curve. Like if you're looking at the S, you're wanting to get the things on the inside of the circle, not the outside. You can still put things for reducing pain there, but you want to reduce spasms in the areas where that S is. And so over a period of time, if that is treated, you can take a lot of the pressure off the elongated side, which starts to reduce the tendency for the pain pattern. Scoliosis can be very difficult to treat, but if you treat it consistently, you definitely can unwind it somewhat. A lot of times, again, people will start to seek out treatment for pain when they're in the crisis and not really try to do prevention. But with something like scoliosis, you're kind of really always in crisis, regardless of pain levels, you're kind of always needing to do it. Now, there are some forms of scoliosis where it's just a hip has been elevated or shoulder's been elevated, and it can be corrected by, balancing out the pelvis and the shoulder girdles. It still takes a while to unwind it, but when a person has like that idiopathic scoliosis, a lot of times you're doing kind of a pain management approach. And so I would treat it as nerve pain, and I would treat the inside of the like if I drew an S like this, here with antispasmodics, and then the outside with things that reduce pain. Does that make sense?
Yes, sorry.
Yeah.
Someone typed in a question as
Yeah.
well.
Fire away.
They said, hello, I don't have any background knowledge of aromatherapy or physiology. Also, is attending this workshop a good idea for me?
Pain is something that everybody deals with, even if you don't have a background in physiology. Your body still is going to be going through pain at some point. So, I leave that up to you. But, essential oils are one way that we treat it. I've treated different kinds of pain syndromes a lot of different ways. And so sometimes if you understand the mechanics, you can treat it in multiple ways. It doesn't have to always be with essential oils. And so, you know, you can leave it up to you if you want to listen or not. But
Go ahead, Dr. Tyndall.
hey, Dr. Tyndall.
Hey, oh, you have a question?
No, I just saw you had unmuted, so.
Oh, I'm sorry.
Yeah, anything you would like to add with everything that we've been talking about so far? Because this is kind of your bread and butter area.
Yeah, so back to Christy's, she can get, the medical doctors would tell her not to, but she can get some chiropractic care also.
Mhm.
A lot of times we'll do some percussor work also. So you can get a percussor, work back to where we
What's
said.
what's a percussor? I don't know what that is.
You have a percussor sends a vibration up and down through the system. So like if you had like congestion in the lungs, you would actually thump. That's percussion.
Oh yeah, okay,
So you're thumping through.
Yeah, yeah.
So so what it does, it releases the fascia, because what happens when you have that injury and that surgery, that fascia, instead of being nice and is tightened up, what you're talking about. So if you do a percussor, that loosens the fascia also.
So what kind of things are a percussor? Like, is it those vibrating massage guns?
Well, it's not. Well, it's like Wall makes a little like for this girl, I would say like Wall makes a WAHL. Wall makes a percussor. It's up and down, not a vibrator. Most people use vibrators. It's massaging. That's right. Side to side. You want up and downs because you want to put that pulse up and down through that tissue to break up and loosen that fascia. And the other reason that have pain too is that we call it in range of motion pain. If a joint's in its neutral, it's very strong. If a joint's at the in range, it's very weak. And so you traumatize back to what you're talking about, that soft tissue in there, because it can't hold and stabilize. So with the curve, they're already at range of motion. So when they bend a little bit more or they get weight load, it's putting pressure on that joint. So it's damaging the joint. So, you can't get her back to the center. So you want to get her moving. The yoga, we tell patients, like with our patients, we'll tell them to do yoga, percussor work, get adjusted, because you can adjust above and below the rods. And you can do some muscle work too through there.
Oh, tremendous. So you can still do adjustments even though they have rods.
Oh yeah, I got several patients that you have to know what you're doing. That's where back to training. I'm kind of back to that geeky thing. I'm a diplomat in chiropractic orthopedics. So there's only one, I'm the only one in the state. There's only 5,000 in the whole world. So we work on, I work on shoulders, ankles, we work on, I get really bad spines. So it's, back to I like figuring out the puzzle that people can't fix. Right. I like fixing them. So that underlying mantra there. But yeah, there's things that she can do, keep it active, staying away from sitting, keeping the soft tissue and everything moving.
So in one of the ways that we like to go through and check, because you could have been in nerve pain 2 years ago, 5 years ago, 10 years ago, it could disrupt your respiratory tract, and the pain goes away and you don't really think about the breathing part. But this is usually the way that I have people test it without having a device or anything. There are devices that you can use to go through and measure this, but basically you're just doing this. You're taking a long, slow, deep breath, and you're going as slow as you possibly can. Like you go, and then you hold your breath, and then you try to make your exhalation go as long as your inhalation, or even a little bit longer. And so when you have bronchial spasms, this is what you do. If you watch me, you go like this, you go. And I hold my breath, and then I go, okay, now I'm gonna let it out really slow, and then you go. And then it's just like really super short. It's because the bronchioles are in spasm that it makes it hard for you to control the exhalation. And so it impacts your nervous system, but it actually over a period of time will even impact your thought processes. It will actually even impact your ability to have higher cognitive function and your ability to dream at night when you're sleeping. And so bronchial spasms are a byproduct of sharp stabbing pain. I mean, there's other reasons they happen too, but they're sharp stabbing pain, and they can eventually cause not just sleep disorders, but they can actually cause cognitive issues. And so one of the ways that you can do it, even without essential oils, you can just do this. Like you inhale, and then they call it pursed lip breathing. And you make your lips really tight, like you're trying to whistle. You know, you make the hole really small so that you have to really force the air out of that little small hole or opening between your lips. So you go, and then again, and then really tighten your lips. Let your breath normalize for a moment. Okay, again, long, slow, deep breath. Press your lips together, and then one more time. Long, slow, deep breath. Press your lips together, and then force it out. Okay, just be still for a moment. Just let everything normalize. Just let that happen. What you're doing is you're manually opening up the bronchioles. Okay, so now we're going to do the test again. So you're going to take a long, slow, deep breath, hold it, and then exhale as slow as you can. Did you notice a difference? Anybody have questions about that particular breathing? This is something that you can use for sharp stabbing pain. And a lot of times just this breathing will actually reduce the pain. So let's make sure that you have this down. So any questions coming from this?
Someone said, yes, the difference is remarkable.
Yeah, it is. And so here's the thing, is you'll notice, like even doing this, you'll notice like your thought processes improve. And then you'll notice like my sleep gets deeper. I'm dreaming better, or I'm starting to dream when I wasn't even dreaming, right? So this could be something that you do on a daily basis, even if you don't have nerve pain. You know, it helps open up the bronchioles. And, you know, we utilize the use of something that is antispasmodic for the smooth muscle. So we use something like hyssop is something we use quite a bit. We use another one called Ami Visnaga, or some forms of spruce are really good to inhale. So you would inhale it and then still do the pursed lip breathing, and it would just deepen it. So for one, a lot of times it will relax the diaphragm. It starts to loosen up the spinal muscles, which takes pressure off of the spine. But you'll notice like your head's clearer, like you're able to think easier, right? And a lot of times your neck will actually even start to loosen up. And a lot of what you would call like sinus pain, that's like pain that radiates around the eyes, and even pain in the ear, is actually referred pain from neck muscles. There's a muscle called the sternocleidomastoid that will actually refer pain up into the sinus area and into the ear canal itself. And it's the muscle that helps to elevate the rib cage when you're breathing with a stuffy nose, or when you're having difficulty breathing. It's working against the diaphragm to elevate the rib cage. And so when the diaphragm is tight, it works harder and eventually produces the result of pain in the face and pain in the ear that people would refer to as nerve pain, when a lot of times it's actually coming from your neck. This muscle also passes over the carotid sinus, which affects blood flow to the brain, right? So if you have some form of asthma, if you've had a respiratory issue, one of the things that was happening with COVID was people were having such difficulty breathing for a period of time. Basically, their chest muscles and muscles around their rib cage, their diaphragm, their neck muscles, everything got super tight, so that when the virus was over, they weren't able to take a deep breath, because they basically, like how you would strain your back, they strained their respiratory muscles and weren't able to take very deep breaths. So you have to systematically go through and unwind the skeletal muscles that aid in respiration so that they can start breathing more normally. No, very good to do, like anytime you've had a cold and flu, if you've, even exercise to the point of exhaustion, you can do it. You had a stuffy nose, a sinus infection, under lots of stress, any of these things would be reasons to slow down and deepen the breath. In spiritual circles, they do things in the Jewish tradition, they do this in the Buddhist tradition, where, you see like this is a conch shell, right? And so they would do things to blow on the conch shell. In the Jewish tradition, they have this horn that they blow. It's kind of like this curly horn. And you really have to, it's like pursed lip breathing. You have to really blow hard. And it's supposed to take you to higher states of consciousness. Basically, what it keeps doing is it keeps unwinding the bronchioles. And when you unwind the bronchioles like this, you really start to shift the way that you process things mentally. When we are doing our normal everyday life, we're using what we would call the concrete mind. And then when we're taking in new or abstract information, you're forming strategies, things like this, you're using the abstract mind. When you're really stepping out of the box and like are a bit innovative, or you're seeing the big picture, or using a little bit of intuition, or in dream time, you're using what you would call the intuitive mind. When you have restricted bronchioles, your ability to reach the intuitive mind basically shuts down. And then your ability to reach the abstract mind eventually will also shut down. And so why is that important? Dreaming isn't just an activity, it is actually a process that your body is using to heal the byproduct of, you could say, the impulses that come from the body, so to speak, right? So when we think of emotions and thinking, we think of it purely from the point of view of a psychological point of view. But you also have physiological emotions that eventually turn into a physiological thought process, right? So anytime that you think something, it produces an emotion. And anytime you have an emotion, it produces a thought. Those two are very intertwined, right? So if you are sitting there and you're processing some information and you think about something, it produces an emotion. I like this, I don't like this, I accept this, I feel love for this, whatever it is, right? But your body also produces emotions for you to take action in the external world, for you to be able to thrive and be safe in the external world. And so one of the examples that I use all the time is you touch a hot stove, right? Okay, you put your hand on the stove and you don't go, well, mentally I'm saying there's some tissue damage, my hand is hurting, I think I should probably take my hand off because there's so much tissue damage, it's going to take a long time to heal, I'm going to take my hand off. You touch it and your body goes, ow, and you have that emotional response, right? The emotion motivated you to get your hand off that hot stove as quickly as possible. You're constantly being bombarded by physiological emotions that eventually turn into a thought process where your mind goes, okay, I have to make sense out of this. What is this? What is this piece of information? And so from there, we get these thought processes or repetitive thinking that we have a hard time getting rid of because they're not psychological in nature, they're physiological in nature. How do we let go of those? Is by touching the intuitive mind, right? By touching the intuitive mind. So when you go to sleep at night and you dream, part of what you're doing is you're letting go of those physiological emotions and thought processes. You're just letting them go because you didn't generate them by your psyche, you generated them by your body. And so over a period of time, what happens is if you're not able to reach this state, then it becomes harder and harder for you to heal psychologically. Now, the reason why, like they use it in Buddhism, and the reason why they use it in the Jewish tradition is this is also tied to higher states of consciousness. Like when you sit and do meditation, when you do ceremony, you're trying to get into that intuitive state. And, you know, at first you're just letting go of the emotions, of the thoughts that have accumulated, but you're trying to reach these higher states, which means you're having to shed this lower way of thinking. And so these processes are tied to your physiology. So built within their practice, they do things to open up the bronchioles so that it becomes easier and easier to reach these higher states of consciousness, right? So in these higher states of consciousness, it's much easier to have peace. It's much easier to have stillness. It's much easier to be non-reactive. And here's the test, right? Here's the test. When you have an emotion or a thought and it's of your psyche, you can see it in almost like a three-dimensional way. You can see the consequences. Okay, this is uncomfortable, but in a little while it will pass and it will get better, or I'll go to the doctor tomorrow, or I'll have a conversation with this person and we'll resolve this issue, right? When it is physiological in nature, it feels like what is happening right now feels like it's always happening and it's never going to stop. Like you have to take some extreme measures to make it stop because of it's always going to be there. It's never going to be different. It's never going to change. That is the very nature of what your body is trying to get you to do, to take action in the environment. It's trying to get you to take your hand off of the stove, right? It's not think three-dimensional and think about what it's going to be like in 3 weeks or something. It's like, get your hand off of that stove. It's all or nothing right now. So that all or nothing feeling and that all or nothing thinking is physiological in nature. It's not of your psyche. Eventually we identify with it. We do identify with it. But things that happen with us that start off as a physical pain can actually eventually affect how you think and how you feel. It eventually causes a sleep disorder, eventually, depending on how severe it is. So, I mean, that is a very substantial thing to say right now. So let's have some questions just based on what I just said.
So we had a few. We actually had one that said, what if I don't dream?
If you don't dream, I would do the breathing, for the bronchioles. And the other thing that can impact your dreaming in your physiology is actually your hip flexors. And so if you do the gentle, how they do, what do they call it? The cobra pose in yoga, where you're just lifting up the front half of your body. Or you can put yourself up against a couch and do your legs at a 90-degree angle and then a 90-degree angle again, and just rest there for 15, 20 minutes. Sometimes that will take some of the tension out of the hip flexors. But the very first thing I do is I'd work on the breath.
Now back to the breath. Is there any issue with that type of breathing if one has a tendency to high blood pressure?
Yeah, it would probably lower your blood pressure. you know, like while you're doing it for the moment, because you're having to push really hard and get it out, you know, your blood pressure might go up a few points. But if you do that over a period of time, your blood pressure will probably go down.
And someone said, I've got my hyssop in my hand. Could Greg please do that breath one more time?
Yeah, sure. If you guys want to do it again. So if some of the ones who have oils handy, again, hyssop, um, Sitka, or some form of spruce. Frankincense actually works really good for this. Ami Visnaga, and there's another oil called Anula that is a very good healer for the lung tissue. We're in the process of running down, there's another conifer called larch that comes out of Canada, but it's really fallen off the aromatherapy wagon over the last couple of decades, and nobody really produces it. But we have a producer who is making it, and we're getting a batch in May, and it is by far one of the best things for deepening the breath. I mean, it's just amazing. We just got a little bit of a sample, and it's already mind-boggling. And so one of the things that we do when we utilize the oils and the blends and things, we're not going to go into this right now, but just to know, like when we go through and evaluate like different respiratory functions or like a pain function, we're also looking at the aspects of what brain waves are impacted with what health issue is, what the health issue is. And so when we make the blends, we try to go down the rabbit hole the best that we can with everything that we're talking about, but we also try to stimulate the part of the brain associated with the brain wave to help reinforce a longer effect when we're trying to treat a particular condition. Like for example, a lot of pain issues have issues with delta waves in the brain. And so, you know, when we make some of the different pain blends, we are not just working for pain, we're not just working for the specific type of pain, but we're also trying to regulate some of the brainwave issues as well. So we try to take it even deeper, but we can't really talk about it in this class because it's just too much information. Like I said, it was a 200-page booklet. So we've broken it up into several classes. I've only recently started talking about the brainwave component. And so we'll go through, and if you don't have the oil, just practice the breathing again. But if you have one of the oils, go ahead and inhale. So ready? Inhale slowly. And then hold your breath, purse your lips, and then force it out really slow. And then again, inhale. Hold your breath, and then slowly purse your lips, and then slowly release and let it go. Okay, give yourself a minute. Just be still for a second. Just let your breath normalize for a second. You get a tendency is to get a little lightheaded when you do this. So just let yourself regulate for a moment. Okay, again, long, slow, deep breath. And then hold. And then exhale through the pursed lips. And then again, inhale through the nose. Long, slow, deep breath. Hold your breath. And then purse your lips. And then take a long, slow exhalation. And then just be still for a second. And then how do you feel? Let's go ahead and get a little bit of feedback, or if you want to ask a question, feel free to ask a question.
It was asked, when would turtle breathing come into play?
For this, you wouldn't necessarily do turtle breathing for this. This is just strictly for unwinding the bronchioles. So for those of you who don't know what that person is talking about, turtle breathing is a different kind of breathing technique that's utilized to do some other things. But for this, you're just trying to unwind the bronchioles.
Someone said they're sleepy, another feeling very peaceful.
Yeah, so notice, like, you feel peaceful, you feel calmer, you feel sleepy. So a lot of times what happens when people are in pain for a period of time is they start to get anxiety, they start to have mood issues. It is physiological. It's not that the person is just being emotional or whatever. It is physiologically produced. Then they eventually will start to have a sleep disorder, and there's a whole range. There's like 35, 40 sleep disorders. And so it could be any number of development of one of the sleep disorders, depending on what the condition is. But a perfect example of this is chronic fatigue and fibromyalgia. You really have to use a very multifaceted approach. The brain waves are really thrown off, and they have usually substantial sleep disorder, very substantial sleep disorder. And it is a brain fatigue issue. It is by far a brain fatigue issue. So
we have lightheaded and ready for bed.
Yeah, lightheaded and ready for bed. Yeah. So if you think about it, like if you're having a hard time going to sleep, I mean, you don't even need the oils for this. The oil enhances it, but you could just sit on the edge of your bed, do this, 3, 4, 5 times, and then lay down, and you'll probably conk right out.
Peaceful. I love hyssop.
Yeah, nice and peaceful.
Does it also help to reduce fatigue in general?
It depends on the nature of the fatigue. Fatigue can be, again, multifaceted. But if you start getting more restful sleep, then fatigue levels can go down. But there could be digestive issues, there could be endocrine issues. Like you heard all the things that Dr. Tyndall was saying. Like if you're trying a few things and with improved sleep, you're not getting it. Part of the physiological thought processes are tied to also endocrine function. And so, like Dr. Tyndall said, like he could go on and on and on about it. But a lot of our thought processes that are physiological in nature it's our endocrine system functioning through our brain. And so, your endocrine system, the hormones and things that are carrying messages, and sometimes your thought processes are tied to some of these hormonal patterns. And so when Dr. Tyndall was talking about going through and treating these different conditions and going through, such detailed ways of looking at it, I mean, he's also impacting part of how you think, how you process information.
Someone said they're feeling chill.
Yeah, feeling calm and chill, regardless if you used an oil for this, right? And so a lot of times if you have sharp stabbing nerve pain, this will actually just by itself reduce the nerve pain.
I did have a question from a while
Yeah,
ago.
yeah, fire away with questions.
I had my right hip replaced over a year ago. The
Mhm.
outside of my right thigh from hip to knee is numb and tingly. Is there a way to unwind this?
Yeah, so that can still be from the hip. That could also be from the low back, and that could be actually just from the surgery itself. You know, when they go in and do that, you know the all the mechanics of what they had to do. And so I would use a couple of different things. I would use marjoram on the thigh. You could rub it on in like an alcohol base or a massage oil base, and just like every night before you go to bed, just rub some, 6-8 drops of marjoram in some lotion or massage oil, and then just rub it all over the thigh. And then the other thing is, when people talk of scar tissue, they think of the literal aspect of like the tissue being cut. But like you have the tissue that's cut, but underneath it is you have connective tissue or fascia, like Dr. Tyndall was talking about. And when you have an incision or when you have a joint that's compromised, and sometimes it's not the skeletal muscle itself, but that connective tissue will go into a type of spasm, right? So in the old days, we used to refer to this as a lesion. It doesn't mean tumor or anything. It just means like a spasm, but in the fascia, right? Or in the connective tissue. And so what this does is, for one, it can compromise the way nerves function, right? It can reduce blood flow to the particular area, and it can start to cause some body misalignments because there's like a big knot in the connective tissue. And so one of the best things to use for that kind of issue, like post-surgical especially, is the helichrysum that Dr. Tendo was mentioning. You can apply it neatly, which means just directly onto the incision site, which would still impact the area down the leg. And then I would put 4 or 5 drops in your hand, and then with some massage oil, rub it into the thigh and on the butt cheek. And I think over a period of time, you'll probably start to notice a difference within a few weeks. I mean, you might notice it even in the first or second application, but within a few weeks, you should notice substantial difference. And you can rotate it. You can start with the helichrysum and then eventually switch over to the marjoram. Marjoram is an amazing oil. It is a very good antispasmodic, right? Like if you were to get a cramp in your calf, it's like, say you're in the middle of the night, you're sleeping, and all of a sudden you get the Charlie horse in your calf, right? If you woke up and put like 2 drops or so of marjoram, even up on the thigh, not even on the spot, on the thigh, the cramp will start lessening up and will go away almost immediately. Like that's how well marjoram works. And so when you have, for one, you had a period of time where the joint was degenerated and your body was compensating. And then 2, then you had the surgery site, right? So you want to undo the fascial lesion, which people call scar tissue. And then you want to undo the spasm and the tension in the body from having the surgery and the compensation prior. And so first you would treat with helichrysum, and then you would follow it up with marjoram over a period of time, and you could really affect a significant change in that thigh. Yeah, we almost always have people, anytime there's a surgery, we usually always have them follow up with helichrysum after the wound is closed and start breaking down that scar tissue almost immediately. It doesn't matter if the scar tissue is 2 months old, 2 years old, 20 years old, 40 years old. It will start breaking up that lesion immediately. So even if it's an old wound, it does not matter. The age or how long it's been there does not matter.
Any suggestions for osteoarthritis pain in the hips?
Yeah, so osteoarthritis pain is actually what I was going to talk about next. So osteoarthritis is the joint is breaking down, the cartilage is breaking down. There can be some spurring in there as well, which means like calcium deposits. But basically, this is a joint that is starting to become compromised. The cartilage is starting to thin. So a lot of times where you see osteoarthritis is in the knees, in the hips, and in the spine, right? It's usually on weight-bearing joints, right? So with that, for one, we use marjoram on the area because your body is always trying to protect a joint that is a little bit compromised. So even if you unwind the spasm there, what happens is your body goes, yeah, but this joint is compromised, so we're gonna tighten up so you don't use it as much. So you have to kind of keep unwinding those spasms over a period of time so that your body stays loose and you can get enough blood into the area. Then we want to get good, healthy blood into that joint. So, formulas from the old days would be like the use of like rosemary, cedar, juniper, hyssop. Rosemary is really good for the treatment of a degenerating joint because it helps get blood to the area. It also is antispasmodic in nature, and it's what you would call a cephalic. A cephalic. The cephalic simply means that it moves blood towards the head, right? So when you're putting it on the joint, part of what rosemary is doing is trying to help move the blood out of that joint so that fresh blood can come in. It's just like if you had a teacup and it was 3/4 of the way full and you would like a nice new cup of tea, you got to dump out that old tea to get that new cup of tea, right? So the same idea goes into the joint. So we have like, you can use single oils or you can use blends where you go through and systematically move blood in and out. So even back a couple 100 years ago, they were using this formula. A lot of times it was people of royalty who would use this, but they would have pretty substantial arthritic issues, including rheumatoid arthritis, where the hands are disfigured. You could actually use the same formula, and you're using rosemary to get blood into the joint, and then it's starting to move away, and then you use like a form of cedar or red pine, some form of a venous tonic that helps blood get back to the heart. And then, something like juniper is to help disperse the fluid retention in the joint itself. And just like a simple blend of like maybe 3 or 4 oils, even just one single oil applied to that area on a regular basis will slow down the degeneration and even stop it. Like, so if that cartilage keeps getting thinner and thinner, by using this on a daily basis, it actually will substantially slow it down and even kind of stop it. Now, you're not going to reverse you're not going to get cartilage to grow back, right? But you can stop it in its tracks. You can stop the breaking down of the cartilage. Cartilage doesn't have its own blood supply. So the best thing to do is, if you even have a little bit of cartilage there, if you start treating it pretty regular, quality of life can change substantially, right? So the other thing is, like, the closer it gets to being bone on bone, the more that you really have to pay attention to treating the lymphatic system. Because what happens is, when those two joints are rubbing together, you're starting to generate some inflammatory material that then starts to circulate through the body. And what will start to happen is inflammation will start to happen in other parts of the body. You'll basically start getting systemic inflammation, like it'll become a systemic lymphatic issue. And so it just means your whole body is not able to detoxify. So the organs will start to be impacted, other joints will be impacted, old injuries will be impacted. So if you stay on top of it, I mean, you can get years or even decades, as long as there's some cartilage there.
Now, is Brachyphyrum an acceptable substitute for rosemary?
It's very similar. Yeah, so it would be good. The most premium form of rosemary to use on a joint like that is, there's this, it's kind of actually a rare form of rosemary called Tuscan blue rosemary. And so for years, we've only used it in our blends. We hadn't really made it available to the public. but we're able to get enough of it now where we're making it available to the public. And the only reason is it has all the properties of the normal rosemaries, but it has a much stronger antispasmodic property to the skeletal muscle. You know, rosemary will relax smooth muscle of your gut, and it will relax the smooth muscle of your respiratory tract, and it will relax the skeletal muscle in and around a joint. But this Tuscan blue rosemary, it actually comes out of Africa, believe it or not, is probably twice the antispasmodic as normal rosemary.
And we do have a handful more questions. I just want to address that we do have just about 15 minutes.
Yeah, so let's fire through the questions. Yeah.
Any suggestions about plantar fasciitis and
Yeah.
coccyx dyna?
Yeah, so the coccyx issue, I would say it has to probably be evaluated a little bit. That one can be a little bit complicated. I definitely would say you need to see a guy like Dr. Tyndall with something like that. Oils can be helpful, but you probably need to see a chiropractor for that, to be honest. The plantar myofasciitis, we have a very simple protocol that we actually will be talking about through the weekend, but we have this, what we call a layered approach. And you're doing several things, you know, so you're wanting to relax kind of tense skeletal muscles, but part of plantar myofasciitis is the fascia is inflamed. And so you have inflamed tissue that has really lost tone. And if it's been there for very long, you'll notice that your arches in that foot will start to fall. Like your foot starts to get bigger than the other foot. Right? And so anytime you have inflammation in the connective tissue, your lymph nodes in that area shut down. I mean, bottom line, it's mechanically what happens, right? So we kind of go through and we systematically treat each component by using a single oil to go through it and treat the affected limb, right? So first we take, we use vetiver. It's this oil, it's kind of a thick, calming, soothing oil. It has a muscle relaxing property to it. And we have you rub it in between the toes, right? So this is starting to calm down some of the muscular tendons and things like this. Then we have lemongrass that we have you put in alcohol, right? And so when we go through and do this, you'll spray it on the body or rub it on the body from the knee down. And what lemongrass does, it's very relaxing, but one of its really super unique properties is it reduces the inflammation in fascia. It's not an anti-inflammatory in any other way other than that it reduces inflammation in fascia, right? So because it's a liniment, it goes all the way into close to the bone because it's alcohol, you know, it's in an alcohol base. It's very penetrating and it goes very deep, and then it dries very quickly. Then we have you take the marjoram, and in some lotion or massage oil, you cover the same area after the alcohol is dried. So this, again, reduces the muscular contractures and spasms in the skeletal muscle itself. And then you can use the lemongrass, or you can use thuja or bay laurel, and you just take long, slow, deep breaths with this oil, you know, about 15 long, slow, deep breaths. And just the act of doing this, it starts to get into the lung tissue, and then blood passes through the lungs and then starts to infuse into the bloodstream and starts to affect the lymphatic system. These oils have a way of jump-starting the function of the lymph node and clearing the lymph nodes. And so a lot of times when people are like really even in the process of needing to have surgery, with a single treatment or two, we've gotten them to the point where they canceled the surgery. I mean, I don't tell them to do it, they do it on their own. The most extreme case that I ever saw was actually a nurse practitioner. And, you know, she had been waiting for this surgery for about 4 months. And then she goes, and then I took this class right before the week, you know, 2 days before the surgery. And she goes, now I'm conflicted because I'm going to have to cancel this surgery. And so, I talked to her about a year later. She never had the surgery, and the condition greatly reduced with the first treatment and a few more treatments, and it was gone. And so it's a very effective treatment, and it works like 90-95% of the time. It's something that we'll be talking about in the class, by the way. And if not, I think we've talked about it in a study group, maybe. If we've talked about it in a study group, we have free study groups that we can send the notes out to you if we have it.
And I did just let people know, if you are interested and you live in Louisville, Christy Forrest is the organizer for Louisville in person. And if you are interested in doing the class, even just via Zoom, she put in the link on the website there as well. We have another question as well.
Yeah, fire away.
How would you treat lymphatic system?
So we use essential oils where we go through, and you could take salt baths. You could take even just putting the essential oil on like 3 or 4 drops on your wrist will start stimulating the lymphatic movement. But salt baths are a really great way of doing it. And I also like to have a person rub it on their abdomen as well. And so we have several blends that work. Single oils can work too, but usually I start off topically. Your skin is a big component of your lymphatic system as well. So we also usually treat the skin as well. And so the salt bath kind of hits everything all at once.
And you guys can unmute yourself as well if you have
feel
a
free to
question.
unmute and ask if you'd like.
And whether it's for Greg or for Dr. Tyndall, I just want to make sure you all know that they're both available here for you guys. And Dr. Tyndall, of all the questions that people have been asking, do you have any thoughts on any of those things as well?
Like the guy with had a hip surgery. That also is the L2, L3 nerve root. So I would suggest doing an oil like the oils that Greg said, but also up on L2 and L3 up in that area, because that may be those muscles. Because we see a lot of people when they have bad hips, they develop an abnormal gait, which then and then what happens is spine adapts to that abnormal gait. You develop those bad habits. Once the hip gets in there, you still have those habits of walking. And a lot of times it's L2, L3 that gets jammed up. And that's also the nerve root where that numbness is. So maybe a suggestion of doing it on the thigh, but and also up on L2, L3.
And when you say that, like a lot of the hip, like you said, the abnormal gait, but the area that it hits is that L2, L3 pretty consistently, wouldn't you say?
Yeah, we see it a lot. Yeah. So.
Yeah, I've seen MRIs where literally like half of the disc is gone. Like one side is still there and the other side is gone.
Yeah,
it's compensating for the hip for so long.
Because when you get throw off the mechanics, you have all the compensations that you deal with. So same thing when you're unhealthy, eat bad, you get the compensations.
Yeah, exactly.
Real quick question for Greg: is helichrysum good for keloids?
Like scars that have keloided, you can use it to treat. I'd say treat a small area. The only reason I say treat a small area, yes, they are keloids. Like I have the kind of skin that keloids very easy, and I had several keloids on my body that I treated, and they you can still see where the cut was, but the keloids have gone away. The only reason I say treat a little bit of it at a time is certain skin types, sometimes there can be a little bit of discoloration with treatment, and it will start to happen right off the bat. And I've only seen it happen once, but and I've treated hundreds and hundreds, if not 1,000 cases or so. But I have seen it once, and it's usually like more kind of like Asian kind of skin, but it still can happen. And so just treat a little small area just to make sure that it's not going to discolor. And then after that, you can go for it. Yeah. I got rid of some very substantial keloids that I had had from my youth. And yeah, you can barely see them now. Yeah, helichrysum is amazing for scars. I mean, it is, there's nothing like it. It is truly amazing. It gets used by the cosmetic industry quite a bit.
And any suggestions for varicose veins, especially burning and stinging with that?
Yeah, you know, essential oil wise, you use things like you could actually even use the things that we were talking about for the joint, like the rosemary and like cedar or red pine. That can be very helpful. There is an herb called gotu kola. Gotu kola is really good. It's a venous tonic. It really is very good for getting the blood out of the legs and can take some of the pain and the sting out. I usually also have people use quercetin when there's substantial varicose veins, just for you know, overall health and vitality of the blood vessels and things like that. And so, but the rosemary and the cedar together, or rosemary and the red pine together, can be very helpful.
What sort of skin discoloration with helichrysum?
It just will darken a little bit. Like, and it's only like on a scar. Helichrysum doesn't cause darkening anywhere else, but like on a keloided scar is the only time I've ever seen it happen. And you know, the research that I found, it seemed to happen like 1 in like 10,000 times. You know, it was really low.
Do you have specific recommendations for post-surgery for rotor cuff?
For a rotator cuff issue, you know, you're going to do some physical therapy, but anytime you have a scar, anytime that the body has, you know, had a cut in it, I put helichrysum on that area right off the bat. I use helichrysum kind of as a massage oil or ointment in that area, and then eventually start doing things like the marjoram, like how we were talking about kind of the thigh. You know, like putting marjoram on the spine really helps loosen up the spinal muscles and allows for the spine to either get manipulated more easily, or sometimes the spine will even start to self-correct a little bit. And so when you're going through and you're dealing with post-surgical rotator cuff issues, you're still dealing with some muscle imbalances and things like that. It depends if it was an impingement or if it was a tear. But basically, you want to just start balancing those things out. One of the things that's very good for if there is a substantial muscle imbalance is you can use spikenard. Spikenard or vetiver rubbed on the area is very good for helping to balance out the muscle imbalances. And so that definitely can be used. Things that help reduce inflammation. German chamomile is always super good to use. It's super anti-inflammatory. It has some pain relieving properties. It disperses fluid, and it helps to get rid of the metabolic waste that happens after an injury or after like an infection or anything like that. We also use black cumin. Taken internally. You can get it from the health food store as well. Black seed is sometimes what it's called at a health food store. It helps to reduce inflammation quite substantially, but we use the oil, which is much more potent. And then a couple of drops of galbanum, like on the wrist, which is in the frankincense family, will really reduce your overall like kind of pain. Like it will make your body be able to handle substantially higher levels of pain, and it just doesn't register on the body quite the same. And so it takes some of the weird tension out of your body that happens with pain.
Can I make one suggestion?
Yeah, of course.
The gotu kola, add that, because we're finding that gotu kola helps to helps your body to make type 1 collagen fiber versus type 3 collagen fiber. So you
I
have
didn't know that.
less chance, so you have less chance of scar tissue. So we use a lot of gotu kola in our office for post-surgical or real bad traumas, because it helps them replace that get their body to make type 1 collagen fiber. which is
Wow.
your elastic, stronger, healthier.
Right. I didn't
So
know
if
that.
you, yeah, we love it. We
Yeah.
also call it Botox in a bottle. Women love it because it tightens up the connective
Yeah.
tissue.
Yeah.
Yeah.
Very cool. Botox in a bottle.
Well, we use the herb form of the
Yeah,
Glucola.
there's no oil. There's no oil. I've tried to run down somebody to make it into a CO2, but I haven't found it yet. So
Yeah.
I'm hoping. Yeah.
Yeah, we use the herb. So yeah, it comes in it. Meta herb from Meta herb out of Australia.
Uh-huh. Uh-huh.
That's how we use. It's a great product. So you only need like 1 or 2 a day. So we put them on like Ligaplex 2, like nutritionally, we put them on Ligaplex 1 or Ligaplex 2. It's the nutrition for your ligaments, muscles, and tendons, and the Glucola, and you get that nice strengthening and tightening of the fibers.
Oh, nice.
Yeah.
I just want to make sure I spelled that right for you guys. I was spelling it wrong. Okay.
Yes, GOTA and then KO.
Oh, is it A?
Yeah.
It's
It's a TU on the.
G
Oh, yeah.
GOTU. Yeah, you
U.
spelled it right.
Oh, really?
KOLA.
Thought it was go with a.
So
Yeah.
I spell checked it. A couple more. It's right about time. So I don't know if we need to just clean up or not. But it was, what oils would you use on the wrist and abdomen for lymphatic system?
Again, you could use things like the rosemary. You could use cedar. You could use juniper. Eucalyptus radiata is really good. Helichrysum is really super good. Usually any of the things that are like in the evergreen family can be helpful. Ginger can be helpful. Turmeric could be helpful.
And then just last question, is black seed internally safe just like black cumin?
Yeah, they're the same thing. Black seed and black cumin are the exact same thing, just different names. Yeah. Yeah.
So I want to just say thank you, Dr. Tyndall. Thank you, Christy, for getting this together for everyone. I am going to just let everyone see if you guys are interested. This is Dr. Tyndall's website. This is Christy's website. She's the organizer in Louisville. She also does meditations. She does her own classes and things with oils. And then this is Greg's information, theplantfrontoils.com. Well, this is .com. It's .com. And so you'll have that. But Dr. Tyndall, Christy, anything else you guys want to say? Greg, anything else you guys want to say?
I just say, like, you have that local resource there with Dr. Tyndall, and you can also reach out to him via his website and everything like that. You can see how in depth and involved his treatments are. So I mean, I love the things that I do, but he's a super good resource for you guys there locally. And if you have like thyroid issues, I mean, that's something that could be treated at a distance. And so definitely reach out to him.
Just all I can say is I appreciate it that you do these for us, and I'm always learning something new from you. So it's always a great day.
Go to college. I didn't even know that about the college.
Yeah, it's a great.
And I hope you guys have some good weather or some bearable weather there for a little bit.
It's Kentucky. It'll turn around in about 15 minutes.
Yeah.
So this is Christy Forrest. Thank you, Dr. Tyndall. Thank you, Greg. Thank you, everyone who's joined us tonight. If you do want to join the class, you don't have to join in person. We are doing it via Zoom as well. And you receive the recording so you can it. So we can make something happen for you if you still want to do that. Feel free to give us a call, and we'll be going really in depth on these subjects. So
yeah, and it's experiential. So we'll be practicing, with your kit. You'll be practicing on how to treat some of these different conditions and go from there. So
yeah, it's a healing weekend for sure. Thank you.
Thank you guys.
Take care, you guys. Sorry I couldn't be there in person.
Yeah, but rather have you safe.
Yeah. It seemed like it was going to be the craziest day to travel today. So
yeah.
We need the teacher, so we'd
Yeah.
rather stay safe.